Well, hello there. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, Buchanan. Again, apologies for my lousy name in this podcast, but I want to talk to you today about peripheral neuropathy. Now, we have a program here at CoreHealth that we deal with cases of peripheral neuropathy, and every so often something comes through, almost like a lightning bolt, to change the course of care. And what I want to talk to you today about, the name is called the Stimpod NMS460, but fancy name. But what I'm seeing is the results that are kind of blowing my mind. Okay, so let's give you a little primer on peripheral neuropathy. Peripheral neuropathy is a problem with the nerves acting as the body's electrical wires are damaged. Okay, so it basically leads to a breakdown of communication between the central nervous system, which was inside your skull, and the central and the spinal cord, and the stuff outside, which is called your peripheral nervous system. So think of these wires have to be working properly. You ever leave a phone off the hook in the old days, and you would hear the buzz, buzz, buzz? Well, that's kind of think about your brain trying to get information, and it doesn't get the information. And typically, we have idiopathic, which we don't know where it comes from. Some people get peripheral neuropathy that way, but you're going to have it from, alcoholics have a high, probability of developing peripheral neuropathy because the sugar in the alcohol kind of kills the covering on the nerve called the myelin sheath. And I'm going to try to not get as technical. The other two people get it the most are going to be your diabetics and your chemotherapy patients. So what happens is, typically, right now the traditional treatment is going to evolve around symptom management through medication. And the medication is Lyrica, Cymbalta, gabapentin. They're never going to address the root cause. It's just your doctor's way of saying, well, hey, I've got nothing else to offer you. Let's try this. Big pharma says to them, this is what we're going to do to treat it. But it doesn't do jack for peripheral neuropathy. It also, it's bad enough you have it, because usually peripheral neuropathy is not just a one-off issue. It's a comorbidity. So it makes everything else you have going on even worse. So what ends up happening is you get brain fog. Another really serious thing is, weight gain. So basically, you're sitting on the couch more than you need to be sitting on the couch, which isn't helping blood flow, which is another way to help minimize the effects of peripheral neuropathy. All right, so it kind of snowballs very quickly in this case here. So what I'm trying to say is medication. You can take it; it's not going to do anything for you. It's basically, and if it worked 40% of the time, I'd be surprised if it was even that high. But that's what you do. You go to your medical doctor. He's going to know everything, or she's going to know everything, and this is what the doctors do these days. So when I started using the Stimpod, it really changed things, because it's not the only treatment we have for neuropathy. But what happens is it uses, this machine is actually from South Africa, and I don't know many other practitioners using it. I'm in Connecticut, so I'd like to know other practitioners so we can do a meet up and tell stories about it. But here's what happens. It uses a thing called Transcutaneous Pulsed Radio Frequency. So, previous electrotherapy devices would provide pain relief from peripheral neuropathy by jamming the pain signals. So what happens is Stimpod, it uses an electromagnetic waveform, and it's not a painful process. And what it does is it sends these pulses to the nerves that are damaged. Okay, and so what happens is, again, the other thing of just is pain relief. By jamming the pain signals with the older generation stuff. The Stimpod does is it works on cellular and metabolic restoration. So it's almost like at the root core of peripheral neuropathy, you have a dysfunctional nerve cell, and think of it as an energy crisis. You can't produce enough energy, so cell starts to die. In a sense, again, I'm trying to keep this as in layman's terms as much as possible. The Stimpod re- it recharges the nerve cells mitochondria. What the mitochondria is in the cell, it's the boiler. It's where energy is produced in the cell. So on a cellular level, the transcutaneous pulse radio frequency signal fires up the boiler, or the energy center in the mitochondria in your cell. And what happens is you have, over a period of time, the nerves fire. Okay, it fires an impulse. There's an impulse, and we call it a certain thing is a resting membrane potential. And what will happen is, in the very beginning of neuropathy, or the energy crisis in the nerve cell, it'll fire too easily. Okay, so you change the threshold of how the firing process is. Then over a period of time, it doesn't charge. It doesn't fire at all. So it goes from firing too much to firing not at all. And as that process goes down, your peripheral neuropathy symptoms worsen, and yet at the same time too, as the cell's dying, the nerve cell's dying. So typically, we've always addressed peripheral neuropathy care here at CoreHealth is by blood flow. And to that extent, we do blood flow restriction on a vibratory plate, oxygen therapy, because your cell needs nutrition, oxygen, stimulation, and blood flow. And those are the elements of what we've done in the past. But I think we're seeing better results now by including the Stimpod as part of the overall treatment protocol. So again, it's the transcutaneous pulse radio frequency signal. It provides the resource for the nerve to begin its natural healing and repair process. And so by solving that energy deficit, it starts to return the nerve to its normal functional level. So it's just fascinating, because the Stimpod actually was used originally for neurosurgeons to find the nerves. So actually, it helps find the nerves when we do the treatment, which, from you have a general idea where a nerve should be, but the tool itself helps us find that pretty easily. And so there's certain types of, there's really only two nerve fibers that carry pain. One is called a small diameter C fiber. The other one is A delta, and the A delta fibers are more diffuse, and small diameters are the ones that you'll really feel strongly when you have pain. But by resetting the nerve, you change that threshold of frequency back to normal. And so what happens is that homeostasis, where everything's happy, the mitochondria produce energy, the nerve starts to work again. And it doesn't seem to be a short-term fix, which is what I'm excited about. Because when you get people coming in, you really want to have, you want to see results. And so we're seeing some tough cases. And in a sense, when we work the peripheral nerves in the legs for neuropathy patients, we actually see the nerve working. See, it's kind of, a lot of times, so we know that the nerve fiber is starting to regenerate in a sense, which is pretty damn cool to see. That someone starts the treatment, because the number of treatments depends on how severe and all your other comorbidities that you would have with it. But it is kind of like a groundbreaking thing, because it also allows us to deliver care on a less expensive level, because people with neuropathy, first of all, neuropathy is not covered. I mean, it's going to get covered if you want your lyric acid ball to gabapentin. That's about it. And it just sets the stage for you sitting on that couch longer, more likely to have falls, other stuff going on. So it's like, but this allows us to hopefully treat shorter periods of time, more effective, and bring the cost down. So it's something you may want to look into, or see if a practitioner in your area has it. But I really think it's kind of a game changer. And so, when people can get back to being more active, because when you have peripheral neuropathy, you tend not to be as active. It is the type of thing that could really have that profound, totally profound change in the quality of someone's life. And you get the nerve working again. I mean, you wouldn't fly a plane with some bad wires. Your body's going to have them. You don't want your body to have them either. It's just, again, the peripheral nerves, the way your brain communicates to the central nervous system, to the brain. All right, I'm Dr. Brian McKay, not just a chiropractor. If you have any questions, always feel free to reach out, 203-656-3636, 203-656-3636. Have a wonderful day. Bye.